Everyone, and welcome to the Eyes Wide Open webinar series. Today, we're pleased to welcome Dr. Jane Buxton and Despina Zimi, who will talk about British Columbia's Take Home Naloxone program, which was launched in August 2012. Despina is the coordinator of the BC Take Home Naloxone program and the harm reduction epidemiologist at the BC Centre for Disease Control. And with her is Dr. Jane Buxton, who is an epidemiologist and harm reduction lead at the BC Centre for Disease Control, as well as an associate professor at the School of Population and Public Health Faculty of Medicine at UBC. So welcome to both of you, and we're really excited that you're here today, and we look forward to hearing about your program. So I'll pass it over to you.
Thank you. Hello, everyone. Despina and I are delighted to have the opportunity to share the experiences of implementing the British Columbia Take Home Naloxone program the first 9 months. We are presenting on behalf of the BC Centre for Disease Control Naloxone team, which comprised of Despina, myself, Erin Gibson, who was employed last year as the Naloxone coordinator, and a number of wonderful committed students. The content and comments are those of the presenters and not necessarily the views held by the BC Centre for Disease Control. We will not discuss how naloxone works as an opioid antidote or the vast evidence about its effectiveness in saving lives. Today, we will present why it was important to implement the program, how we developed the program, where we are now, and share the successes and challenges along the way so that others can learn from our experience. In BC, the Harm Reduction Program is a provincial program coordinated by the BC Centre for Disease Control, with representatives from each of the 5 geographic health regions. Therefore, we have a mandate to ensure program components, including naloxone, are accessible to all in the province wherever they live. We will talk about the website and the program implementation models which meet Health Canada and BC specific regulations, and talk about some of the results of our evaluation. We want to highlight this phrase, "This is great. Why don't we have take-home naloxone in British Columbia already?" said all stakeholders. So it brought the question as to why we didn't have it in place. And it was felt that someone had to take the responsibility and do it. Another common phrase we heard was, "This is a no-brainer." So I heard about naloxone at meetings I attended with the US epidemiologists and thought, what a good idea. In May 2011, the BC Coroner Service released a warning about a spike of heroin-related deaths due to an increase in the potency of heroin. When we looked at this more closely, we found that it wasn't happening in Vancouver's downtown east side, as many had assumed, but in Fraser Health, the adjacent, more easterly health region. Provincial data regarding illicit drug overdose deaths from the BC Coroner's Office indicate 224 deaths in 2010, in BC, which increased to 299 in 2011, but then declined to 256 in 2012. This includes deaths from all illicit drugs, not just opioids. The BC Ambulance Service reported 2,666 doses of naloxone being administered in 2011 and 2,377 in 2012. We also know that prescription opioids are an issue, and in another webinar, Dr. Trevor Cornell spoke about this in his region in BC. So we felt that it was important to develop a partnership, and the formation of the Drug Overdose and Alert Partnership was formed. This has representatives from enforcement, health, ambulance, coroner's office, drug and poison information centre, people who use drugs, and so on. With this group, we were able to develop targeted messaging and getting input from community groups and from people who use drugs. Vancouver, BC is unique because we do have insight, but that is only available to those that are living in the area. So we thought, what about naloxone? It's a drug that can reverse respiratory depression due to opioids, does not cause a high, and has very few side effects. Take-home naloxone programs have been found acceptable and cost-effective. Therefore, we felt it was our ethical duty to make it available to those at risk. The BC Centre for Disease Control Harm Reduction team was committed to developing a take-home naloxone program. A few months later, the MMWR article and the American Medical Association policy statement on naloxone were released. Then came the Ontario Health Bulletin and wide support from other jurisdictions in addition to people working at the grassroots level. We want to emphasize the considerations needed to take in order to develop a program with a provincial perspective. So it was important for the program in BC to cover the entire province. While there may be higher numbers of overdose in the urban centres, rural areas have other issues. For example, the distance to hospitals or delayed arrival of emergency medical services. We received support from the BC Centre for Disease Control to hire a full-time coordinator who worked with students to identify the policies, regulations governing naloxone in Canada and in BC. So for Health Canada, naloxone is under Schedule 1 as an exemption. In Edmonton, when we explored the program there, they have a pre-written order from a physician, which is then signed off by the nurse. In Ontario, they are able to use medical directives, which give blanket instructions by physicians to other healthcare providers, and contains the delegation and provides the authority to carry out treatments. However, in British Columbia, we don't have standing orders or medical directives for nursing staff. Naloxone is a prescription-only medication, and a physician or a nurse practitioner who knows or has seen the client is the only people who can prescribe. After identifying these policies and regulations, the design and the development of the program followed. We must emphasize the number of stakeholders consulted in this process. As you can see, there was a large number, and certainly not for the faint-hearted, to really get an engaged process. We had amazing support from our colleagues in the US. They were enthusiastic and passionate and willing to share their tools and experiences to help us implement our program. We would also like to thank the folks in Edmonton and Ontario who met with us. The BC CDC developed the program implementation guidelines and educational tools to ensure they were consistent with the BC regulatory framework. Like elsewhere in Canada, naloxone is not on the provincial formulary, so has to be paid for. Currently, we have temporary funding from the BC Harm Reduction budget, and we have met with the Ministry of Health Pharmaceutical Division in January 2012, and discussion around this does continue. We launched the program August 31st, 2012, which was Overdose Awareness Day.
And now I'll continue. My name is Despina and I work with Dr. Jane Buxton at the BC Centre for Disease Control. My role here is really to help assist sites who want to provide naloxone to their clients understand how they can implement the take-home naloxone program, which meets Health Canada and BC regulations. These sites are usually service organizations or health centers. Sites that have worked out a plan which has been approved by the Regional Health Authority and satisfy the regulations receive kits from the BC Centre for Disease Control to dispense to clients. But there's more to that than just dispensing. The #1 resource for take-home naloxone sites is the Toward the Heart webpage, which we have up on the screen. As Jane mentioned, we wanted this program to be provincial in scope, and therefore we developed this webpage with all the information sites would need to know. There are training resources including videos, program implementation guidelines, news, sections developed for different service provider groups, and all the forms necessary and required to be part of the program. We encourage you to check out the webpage because it's a good hub for information of the programs in BC, other programs in Canada, and programs around the world. The web page can be found at www.towardtheheart.com.